I recognize the member from Ottawa Centre.
Thank you, Speaker. Thank you to my colleague. The homeless crisis in this province is a housing crisis. You have failed on the housing crisis. And Bill 6, the Safer Municipalities Act, imposes the most punitive measures on residents of encampments for the simple act of being without housing or shelter. It targets people who are experiencing homelessness, people believed to be in possession of drugs in public, as a means to immediately evict them, arrest them, jail them, or fine them $10,000, which no person who is homeless today could possibly afford. And while incarcerating people living in encampments may reduce the visibility of unsheltered and unhoused individuals, it does absolutely nothing to enhance public safety. Instead, it destabilizes the most marginalized individuals in our province. It pulls them away from any social supports they may have, often causing them to lose their belongings, including essential identification. And this, in turn, makes accessing income and other supports almost impossible. And it puts people back on the street or in a park or somewhere even less safe because there is simply nowhere else to go just to exist. We agree everyone deserves to enjoy parks and public spaces, and that parks are not homes. Tents are not homes. But everyone also deserves a safe, affordable, and dignified home. Tents and prisons are not acceptable replacements for safe, affordable, and dignified housing. And in my riding, we had a consumption and treatment site close. And for the people who were being served in that site, they're now outside. They're in front of storefronts, and they are unwell. There is nowhere for them to go. And what used to occur in a healthcare setting, where people were attached to supports, attached to workers, to healthcare workers, is now occurring outside. So your goal of public safety has had the opposite effect. And there is no doubt that there is a chill on harm reduction in this province. And reducing harm and healing is what we should be thinking about. And the best way to end homelessness is to actually keep people in their homes with protection for renters, doubling ODSP and Ontario Works, providing real housing benefits to those at greatest risk of imminently losing their housing. And the best way to end encampments is to create supportive housing units, allowing people living in encampments or the shelter system to move into a safe, permanent, affordable home, while connecting them to mental health care, addiction treatment, and other supports. A recent article published by the Trillium in April highlights the critical role that supportive housing, well-funded supportive housing, can play in alleviating pressure on both our Ontario's housing and healthcare systems. A cost avoidance review commissioned by the Ministry of Municipal Affairs and Housing and completed by KPMG firm in 2022 found that supportive housing not only improves outcomes for vulnerable Ontarians, something we all want, but also that investments can yield an annual return of up to $2 for every $1 spent. And this is done primarily through reduced hospitalization and emergency department visits. And a more recent report from Addictions and Mental Health Ontario found that nearly 10% of patients occupying mental health beds in Ontario hospitals no longer require that level of care, yet remain there due to lack of appropriate housing. The financial implications are significant, with care for these patients costing up to $1,200 per day, compared to supportive housing costs that range from about $75 to $150 a day. So despite the clear economic and social benefits, demand for supportive housing vastly exceeds the available supply. Over 36,000 Ontarians are currently on wait lists for mental health and addictions supportive housing. 36,000, with fewer than 1,000 placed each year. The Association of Municipalities of Ontario has estimated that more than 80,000 people experienced homelessness across the province last year. And those mayors identified the creation of more supportive housing as a key solution to the growing homelessness crisis. Yet, despite these urgent indicators, this government's response has been inadequate. Much of the new investments announced by the government is simply repackaged from previous commitments. The actual delivery of new units has fallen drastically short. And as part of its plan, as my colleague pointed out, to transition to a heart hub model for addiction and recovery, this government plans to create 560 new supportive housing units, which, if they do get built, would serve 1.5% of the estimated wait list for MHA supportive housing. They deserve a government that is willing to act boldly and invest meaningfully in supportive housing, not one who seeks to criminalize homelessness through punitive measures like the Safer Municipalities Act. Instead, this bill is a misguided approach to public safety that punishes people who, as a result of failed policy and political decisions made in this legislature, are homeless today. Schedule 2 of this Act, amendments to the Trespass to Property Act, amends the Trespass to Property Act by introducing aggravating factors that are meant to disproportionately impact homeless individuals who have nowhere else to go. The obvious comparison to this government's intended punitive approach, in Bill 6, is the complete failure that is the Safe Streets Act, a Harris government holdover that we have always opposed. And as of March 2024, there were $28.9 million in outstanding SSA fines. And that's because these fines are impossible to collect for all of the well-established reasons that unhoused populations have complex needs that cannot be addressed through the criminal sanction system. And what the laying of these offenses do is prevent people from securing housing and certain jobs by putting them into a debtor's prison. There is no net positive. This won't be a deterrent to a population that has complex addiction and/or mental health issues and is suffering from deep poverty. What this bill does not factor are the reasons that many unhoused people resist shelters in favor of living in tents. Unhoused people repeatedly cite dangerous conditions or prohibitive exclusions, such as splitting up couples. Municipalities and service providers will also point out that shelters in this province are well beyond capacity. There is no room at the shelter and there is no housing. Unsurprisingly, this act does not speak to how someone would be forced to take a shelter space after they've been cleared from a prescribed place. The simple math bears it out. A January 2025 report, again from the Association of Municipalities of Ontario, estimated that there were more than 80,000 people who experienced homelessness in Ontario in 2024, and this was a 25% increase from 2022. AMO recommended greater investments, supportive housing, and more support and resources for municipalities that have been left dealing with the consequences of the province's failure to adequately invest in affordable and supportive housing. So even if everyone in encampments today agreed to move into a shelter, there are 3 times more people who are homeless and unhoused than there are shelter beds. So this act has the effect of penalizing people who cannot afford housing and cannot access shelter spaces because of the government's own failings. So people are living in encampments, and there is a clear link between the levels of capacity, overcrowding, and safety within the shelter systems and the emergence of the growth of encampments. The Federal Housing Advocates' Review of Encampments interim report in 2023 summarized what they heard over the course of their public engagement about conditions contributing to the increase in encampments. This is input directly from people who have lived in encampments, from frontline workers, advocates, community members, and from Indigenous people and their representative organizations. One frontline worker described the lack of shelter space as a crisis, noting that lack of space in winter means people are forced to remain outside, exposed to the elements. Some get frostbite, in some cases resulting in amputated fingers and toes. Some people have died from exposure. And in quotes, "We had to drop people off at emergency rooms to keep them alive." The advocate heard of the deep fear and exhaustion from advocates and individuals on the front line of the housing crisis who feel like they are fighting a losing battle as the right to housing becomes more and more out of reach for so many. They expressed frustration at the backlash to encampments because there is no housing for them to offer people. Participants in the review described the severe lack of supportive housing that meets the particular needs of people with active and severe addictions. And this government wants people in treatment, but participants shared that alongside a limited supply of detox and rehab programs, there are not enough housing options for people leaving those programs. They will leave treatment programs, go back into homelessness. People also face discrimination because of their low income, being unhoused, or both. The advocate heard of an increasing trend of landlords not accepting tenants who rely on social assistance. Some people seeking housing shared that the only housing options offered were uninhabitable. Participants described seeing violations of adequate housing standards so deplorable due to rodents, bed bugs, lack of running water, that they would rather live outside. And for many trying to avoid a relapse into addiction, a shelter can also be triggering, as poor mental health is exacerbated by living in a dorm with no privacy. We heard how shelters can sometimes be so unsafe, people will choose to live outside. Many of the participants in the review that were consulted said they face serious safety issues such as violence, gender-based violence, and systematic discrimination and racism. For women and gender-diverse people, staying in shelters can expose them to violence, including sexual assault. Some noted that women, trans women, and gender-diverse people are more likely to avoid shelters out of fear of violence, sexual exploitation, and child apprehension, and therefore have more difficulty accessing services. The Housing Advocates' review of homeless encampments also paints an alarming picture of the housing and homelessness crisis in Canada, particularly its devastating impact on Indigenous people. While the right to adequate housing is recognized in both domestic and international law, including through Canada's commitment to the United Nations Declaration on Rights of Indigenous People, the reality on the ground tells a much different story. Indigenous individuals account for 35% of those experiencing homelessness nationally, despite representing only 5% of the population, an alarming disparity rooted in Canada's legacy of colonial practices, systemic underfunding, and ongoing jurisdictional neglect. In Ontario, Indigenous people are not only overrepresented in encampments, but are often failed by housing systems that are neither culturally safe nor responsive to their specific needs. UNDRIP affirms Indigenous people's right to self-determined housing and urges governments to work in cooperation with Indigenous representatives. Yet the provincial government often funnels funding to non-Indigenous service providers, while Indigenous governments and urban Indigenous organizations remain under-resourced and sidelined. This has left many without access to culturally appropriate housing, particularly in urban areas where Indigenous homelessness, compounded by gaps in transition services, inadequate data collection, and a lack of recognition for Indigenous jurisdiction. This government must stop passing the buck. It has a clear responsibility to act by supporting Indigenous-led housing initiatives, aligning provincial law and policy with UNDRIP, and ensuring that all Ontarians, including Indigenous people, living both on and off territory have access to safe, adequate, and dignified housing. The Safer Municipalities Act in front of us, which increases policing powers and paves the way for forced encampment evictions, runs counter to these principles. Instead of criminalizing poverty and displacing the unhoused, Ontario must invest in long-term, rights-based housing solutions that address the root cause of homelessness, especially those disproportionately impacting Indigenous communities. I want to recount an experience in Ottawa in 2019, and this was before the real explosion in visible encampments. There was a rooming house downtown that was home to 20 people. And that rooming house caught fire in April of 2019. And like all fires, it was in the news, and then it faded out of the news. And by summer, we realized that those 20 people were still sleeping outside. Their home had burned, and there was nowhere for them to go. And by late October and early November, they were huddled every night in the doorway of the community health center, who just lost their consumption and treatment services. They were huddled in a doorway every night, most of them still trying to stay warm. And these 20 individuals never were able to access housing. They set up an encampment, the city shut it down, and they disappeared. I remember going and talking to one of them and asking them, "Do you have a housing worker?" And he said, "Yes, I do. I said, "Okay, good. How's your housing worker going to get in touch with you?" He said, "I don't know." I said, "Well, do you have a phone?" "No." "Do they know where you are?" "No." So that is the reality of people in encampments. They are completely detached. They do not have housing. They do not have access to shelter. They cannot go inside. And often, over time, a short period of time, you lose connection to them. So just in my closing minutes here, I want to talk about an example of closing down encampments that is working. The government of Manitoba is committed also to ending encampments. And their plan focuses on their residents who are currently living in encampments. And while they continue to invest in building housing, both social and affordable housing, their immediate priority is to house people in encampments by making suitable housing available to people living there, and by providing the addictions, mental health, and primary care supports people need to successfully transition into housing. And to meet this goal, they are actively acquiring and renovating apartment buildings to house people from encampments and funding wraparound staffing supports to support these new tenants as they move in. And I just want to quote from the report. Working with municipalities and sector partners on a 30-day timeline, we will offer housing supports to everyone in a designated encampment and work to move people from the encampment into housing. 30 days. This transition will be supported by a new navigation center where people will be provided safe and comfortable indoor accommodations while their needs are further assessed and supports provided. Mental health and addictions treatment and other supports between the encampment and more permanent housing options will ensure that more people successfully make a safe transition from encampments into housing. And when an encampment is empty, we will clean and decommission the site and take measures to monitor the location to ensure the space can be used safely by everyone without new encampments being established. It can be done. At the end of the next 7 years, it is their ambition that everyone in the province has safe and secure housing, their neighborhoods are safer, and sleeping in a tent is no longer an option because they can provide the housing and supports to help people find their way home. And again, under their framework, because I want to be able to humanize the very people that we are criminalizing here. And when I read what the government of Manitoba is doing by taking this immediate action to move unsheltered people into suitable housing, they also are implementing a plan to address the shortage of housing and supports needed to end chronic homelessness. And they're doing this by increasing the supply of social housing with wraparound services. They're creating a Housing First program. They're developing an outcomes-based framework. They're addressing gaps that lead youth and vulnerable people into homelessness by reducing the number of youth entering into homelessness from the child welfare system. And they are ensuring people transitioning out of healthcare services and correction systems do not end up homeless. And lastly, they are doing this, they are inspiring hope and developing pathways to success. And they're doing this in two ways: family reunification, education, employment, and all the steps needed to ensure that those who have experienced homelessness can live the full lives that they have imagined. And for tenants in supportive housing facilities, this may include helping people pursue personal interests and hobbies, participate in meal and housekeeping services, and being able to attend cultural and recreational activities in their community. They'll provide training and employment opportunities available for trades and support services. Because it's a government that has recognized that these are people like you and me and the people in our lives that we love and care for. And this is very similar to the NDP plan to end encampments by, again, investing in real housing solutions, giving people the support they need, doubling ODSP and OW so that people can afford to live in their homes, and stop people from losing their homes by bringing forward real protection for renters so people can better keep up with the cost of housing and keep people in their homes. We would create 60,000 new supportive housing units that allow people living in encampments or the shelter system to move into a safe and permanent home with mental health care, addiction treatment, and other necessary supports. We would upload shelter funding to the province from municipalities and provide more housing benefits to keep people housed and allow them to move out of shelters and into homes. I also want to share an experience as a city councillor in Somerset Ward, which is part of Ottawa Centre. When COVID hit our community, there were many people who really had absolutely nowhere to go. Many of them lived in rooming houses, overcrowded rooming houses, but for the most part, people really had nowhere to go. They had nowhere to, basically just even to use the washroom. And we opened up respite centers, and this is key. We opened up respite centers, and because our recreation services had disappeared overnight, people weren't accessing recreation services, we used recreation staff in our respite centers. And these staff had previously, and they shared this after they'd been doing this for about 6 months, previous to this experience, if somebody had come into a recreation center, an arena, was acting in a way that made them feel a bit uncomfortable, somebody that looked like they might be street involved, they would call security. But what happened in these respite centers is that over the course of 12, 18 months, they got to know people in the center who were coming into the centers who had been experiencing homelessness, and they understood what their absolute unique needs were. They understood them as unique people. They understood that having, big, lists of people who may or may not be homeless was one thing, but understanding that this person in front of you really only needed to be reconnected with their family, and this person over here, only needed a help to get housing, and they were successful in reducing the number of people in our community who needed housing. So I'll just leave you with this, that, what's missing in this act is compassion. And this will remain the case until the government can demonstrate that it has the social infrastructure in place to provide permanent housing for people. And we do, in this legislature, we have the power. We are so fortunate to be here, all of us. And we have immense power to both harm and heal. And I would implore all of us to do what is right for people who are unhoused and unsheltered, and choose a policy that will not continue to harm them. They are unwell. They need our compassion. They need our help. We must choose a policy that will help to heal people, and we will all be better off for it. Thank you.